What about those people who have chosen to take medication and maybe the medication no longer helps, or maybe there's a medication overuse headache? Can you explain what that is and what causes that?
Sure. So I think that's a common etiology for headaches for a lot of patients. And a lot of times patients will take a medication, a common over-the-counter medication, maybe Tylenol, ibuprofen, and maybe they're not even taking it for headaches. Maybe they're taking it for some chronic knee pain that they have. And over time, when you take those medications consistently, then the brain adjusts to that medication and you get a little bit of a rebound effect. And so the medication is not as effective for as long. And so then the patients will have to take more and more. And that's when you get into that vicious cycle of the medication overuse process. And so maybe they've got another ache or pain. Maybe they have a headache and they're taking some Tylenol or some ibuprofen, some Aleve, and it was effective initially, but then it becomes less effective. And so the patients will take more and more, and then they really get into trouble with their headaches or their aches or pains.
I think an important thing for patients to be on the lookout for is medication overuse headache. Patients are at risk for developing it. It's usually in patients who already have a primary headache disorder, and they may take, a rescue medication over the counter, Tylenol, ibuprofen, Excedrin, and they take it, somewhere between 10 to 15 days out of the month. Chronically, usually, the diagnostic criteria sets a minimum of 3 months, and then they start getting more frequent or progressive headaches as a result. So at least half the days of the month, you will then start to experience a headache. And it's actually due to overuse of a medication. Now, how we typically treat that medication overuse headache is, number one, we have to stop the offending medication, and typically the headache will resolve.